In this episode, Colleen shares how a routine physical led to her diagnosis of smoldering multiple myeloma and reflects on the treatment decisions, clinical trials, second opinions, and personalized care that shaped her path toward CAR T-cell therapy. She discusses why seeking a specialist, exploring clinical trials, and weighing every option against her personal goals and responsibilities helped her confidently navigate the years leading up to relapse.
Back in 2014, my job had a new requirement that we had to do preventative health care. And if we didn't do preventative health care, we had to pay a higher amount in healthcare costs. And so I went for a routine physical. I didn't feel like I was having any symptoms. I actually felt pretty fine. I was a mom of a 4-year-old. I was working 2 jobs. I just bought a house. I was a little bit tired, but I thought that was kind of normal. Everybody I talked to that was a mom was tired, so that didn't seem strange to me. So when I went into my physical, the doctor noted that I was very anemic and asked if I was tired, which again, I thought was a bizarre question because parents were supposed to be tired. So I was like, yes, of course I'm tired. I'm a mom. And she did a background check on me and she took my family history, and I have celiac disease in my family. So she decided to do some further testing to see if I had celiac disease. And with that, she noted that I had some high protein. So that began the process of what led to my smoldering myeloma diagnosis. I was being treated in Connecticut, so I was sent to a local place here, and I went and saw a regular hematologist. And so at my first appointment, the doctor was kind enough to go over what smoldering myeloma was. I've never heard of myeloma. This is all new to me. I did not even know what myeloma was. So she explained to me what myeloma was. She explained to me what it could do. She explained to me about the organ damage and all the different things that are not pleasant about the disease. And then she said, but because you're smoldering, that's good news. We're going to watch and wait, which was a standard of care at the time. But I just remember sitting there in her office thinking how horrible it was that I just heard all these things that myeloma can do, and we're just going to watch and wait. So I continued with that center for a while. And to be honest with you, smoldering was really hard for me because you research stuff, you look stuff up on the internet. You don't really know what to make of it. You don't know what's true. And the internet sometimes is a scary place because it tells you the worst statistics about stuff. And so you get really scared. And you don't know what's next, and you don't know what treatment would be like, and you don't know what any of that is going to entail, which is really, 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 really frightening when you're in that position. And then I got to learn something that I would soon find out was a common thing. My insurance company got in a fight with the center I was going to. I didn't know that would be a common theme throughout my journey, but it happened quite a bit. And so I was told that I could continue to go there, but I might be responsible for 20% of my care. And 20% when you're a myeloma patient is a lot of money. So I knew that wasn't going to be feasible for me. So I called up my insurance company and I asked what other places I could go to. And one of the places they mentioned was Memorial Sloan Kettering. And I heard about Memorial Sloan Kettering. It was in the movies and it was on TV shows. So the name was not unfamiliar to me. I was familiar with that name. And so I called up Memorial Sloan Kettering and they were delightful. They got me right in a week. And at that point, I went to the center and I met with an oncologist who specialized in smoldering myeloma. I didn't even know that was a thing. I was seeing a regular hematologist, and then I learned that you could actually have a specialist. Not only did I learn you could have a specialist, you could have a specialist in just smoldering. So that was all kind of new to me. I didn't know that. And so I went there and I met with her, and she told me something that I didn't know at that point in time, which was clinical trials. And so she said, hey, we got a clinical trial here. And to me, watching and waiting was so incredibly difficult. So I was really excited to hear the possibility of a clinical trial. And it was with an IMiD and a proteasome, and it was a proteasome inhibitor and a steroid at the time. So it was a 2-drug combo, but they were all going to be over-the-counter pills that you could take. And so I was very interested. So I swapped to Memorial Sloan Kettering and I started this clinical trial, and I love the team I got. When you do a clinical trial, it's pretty amazing because you get your nurse, you get such a great care team. And so I had these eyes on me that were watching, and I got to learn ahead of time what some of the side effects are of drugs. I think sometimes when people start induction therapy, they start like 4 drugs at once, and that's kind of a shock to your system because there's 4 different drugs and you're trying to navigate all the side effects and stuff that come with 4 drugs. But I got to know a little bit about like what steroids do, which was not my friend. And I learned a little bit about like what some of the other stuff were. And so I kind of learned like how to figure out and how to counter that and how to still have a really good quality of life while going through this whole process. And my myeloma is such that it ticks up slowly. So it's kind of like you're on the Titanic and you see the iceberg coming, but you can't really do anything about it. So my myeloma started to misbehave again, and it was like a little bit each time. Every time I went to the doctor's office, my M spike would go up a little bit and a little bit and a little bit. So I actually had the opportunity at this point in time because I knew I was going to be active myeloma. I was leaving the smoldering world. And that was about in 2019. So I started the trial in 2016. And in 2019, we started to see stuff tick up, right? And so I got to kind of train and kind of learn. And at that point, I already did a clinical trial. I really like clinical trials. And so they told me, hey, we're having a new clinical trial here at Sloan. And I wanted to hear more about it. At that point in time, the standard of care was triplet. So you would get 3 drugs. And it would usually be an IMiD, a proteasome inhibitor, and a steroid. But they were introducing an immunotherapy with that, right? And so they were having this 4-drug combination. And so as I was ticking up, I was being evaluated of whether or not this clinical trial would be something I could participate in. And it was the end of the other clinical trial, and we did my bone marrow biopsy. And at that point in time, my numbers met criteria for I was active myeloma, and I was able to get in this trial. And so I started this 4-drug trial at Memorial Sloan Kettering, which was a lot with time because you had to go there multiple times a week. But they were really fantastic in making it so I could go Thursday, Friday, and then eventually I was able to go Friday. So I was still able to work full time, which was really, really important to me. I liked my job. I liked being able to work, and I still wanted to be able to do the normal things that were important to me. And then my oncologist that I was seeing mentioned to me that she was being relocated to another campus and I was being switched over to this other oncologist, but I was told he was great. And then clinical nurse I had at the time for the trial said, oh, he's the best. You're going to love him. And Memorial Sloan Kettering is a teaching hospital. I tell you this as I tell you the next story. So I went in to see this particular doctor, and he walked in with an entourage of people. Like, it's very common at Memorial Sloan Kettering that 1 or 2 people would come in. But this guy walked in, and there was like standing room only, and everybody had clipboards and everybody was writing down everything he said. And I remember after he left, I looked at the clinical nurse and I said, what's up with this guy? Why does he got an entourage? And she said, oh, that's the CAR T guy. I said, the what? And she goes, the CAR T guy. And that's when I first heard about what CAR T was. And that was in 2019. So after I was doing the trial for a little bit, it was standard practice that you would meet with the transplant team to see if you were eligible for a stem cell transplant or if this was an option for you. And so I was meeting with the transplant team. The particular person I was meeting with also was the guy who did CAR T. So I knew that I was going to have this appointment. So I got to sit there with my husband ahead of time, and we got to come up with some really good questions. And so we went in for a visit, and we got to hear about all the things that stem cell could offer and why it was a standard of care and what that would be like. And then we also got to hear about this new thing that was coming up, CAR T cell therapy. But at that point in time, it wasn't available to me because I was only going to be, I was in the beginning, I was first line. So it wasn't available to me, but I knew that it was coming down the pike. So I opted to collect my stem cells, and I did collect them. And then at the end of the trial, when it came time to, do you want to do a transplant or would you like to go on maintenance? I opted not to do the transplant. For me personally, I looked at what it could offer. I listened to all the medical science of what was available to me and the different trials and the different data points, but I also looked at my own situation, my financial responsibilities, my caregiving obligations, what I wanted from my own life, what it would take as far as recovery was looking like. And for me, I thought that wasn't the best decision for me. So I opted not to do a stem cell. And so then there was another trial for maintenance. So, and it was at immunotherapy, and I love a trial. So I said, oh, that sounds fantastic. Let's do that trial. IMIDs were rough on me. So I was not excited to do maintenance with an IMID because it caused me a lot of GI upset, and I never knew how to plan for the day. For me, with the IMIDs, you'd wake up and you didn't know what the GI issue was going to be. So it was hard to plan for your day because you couldn't pre-medicate because you didn't know what it was going to be. So the idea of doing this immunotherapy sounded great, especially because it was eventually going to fade down to once a month. And that seemed to me like the least cancer-like treatment available. Like treatment once a month, that sounded pretty amazing to me. So I did that trial, and I got 5 years and 2 months. It was pretty amazing.
In the next episode, Colleen will discuss how she prepared for CAR T-cell therapy and her experience with asking questions to learn about the available treatment options, as well as how her professional background helped her advocate for care.